3 common questions that often need answering at the chiropractors. How come my hand and wrist therapy not working? Hand and wrist pain can be very frustrating, and that's putting it mildly. At our clinic we regularly meet people with wrist and hand pain, many of whom are so bad that they've begun to worry about their livelihoods. But what's even more frustrating than hand and wrist pain? Getting complete stuck with hand and wrist pain because the treatment we receive isn't working. As someone who had crippling wrist problems for an extended period once upon a time, I can totally empathize with this. The happy news is that most hand and wrist pains get better very quickly, as long as they are getting the right kind of treatment. Which is generally not just exercises. Most hands and wrist issues have scar tissue that needs to be broken up by someone who knows how. There also tends to be locking of the small bones in the wrist, which need mobilizing. That's what brings relief. Then, only once they are feeling good, tendon strength exercises to make the improvements last. Not ticking these specific boxes is what causes the majority of hand pains that fail to recover to become frustrating. The same truths hold for many other conditions, like stubborn neck pain and back pain for example. How come I keep doing my exercises, but they are not fixing my problem? Let's be honest, we the human race don't exactly have the best track record for keeping up with the exercises our chiropractors gave us. Or doing yoga 365 days per year. Even though most of us kinda know we should. But there are a percentage of us who are so desperate to get better that we actually follow through, and keep consistently doing the exercises. Strange but true. It's great that some of us are willing to put in work, but that can lead to a second layer of difficulty. When the exercise program doesn't get rid of the pain. Which is actually quite a common thing. The reason so many of us struggle to fix ourselves with rehab exercises, like Pilates, yoga, and gym is quite straightforward. Generally speaking, exercises work better for preventing pain and reducing pain. If we have an inflamed spinal joint in our neck that's been causing headaches for years, that's a very, extremely hard thing to shift with exercise. If our knee pain is caused by a deep knot of scar tissue between layers of muscle, right where they attach to the knee, that's a very exceptionally hard thing to shift with exercises. If we have neck and shoulder pain, because the fascia in our upper back has become completely stuck from years of office work, that's a very difficult and hard thing to shift with exercises. Sometimes the best way to understand pain treatment is in the same way we understand dental care. Exercises are as important for treating stubborn pains as brushing and flossing are for managing tooth decay. Very important. But there is no use trying to floss yourself for an hour a day if what you really need is root canal. If you have persistent pain in your tooth, it needs treatment. If you have persistent pain in a joint or muscle, it needs treatment. Then once the pain is under control, it becomes exercises o'clock. Is mixing old with new legit? People often find it strange that at our clinic we combine super modern pain management processes with more traditional forms of treatment. Most clinics operate an either-or policy after all. Our policy is to focus on the methods that make the greatest number of people feel better, regardless of whether they are old or new. And also regardless whether they are traditional chiropractors' methods or methods from other disciplines like physiotherapy and osteopathy. Listening to our doctors, we could be forgiven for thinking that the scientific method has been carefully applied to all the old-school ways of treating pain, and that we found out they are all placebos. But we have done no such thing. We haven't spent anything like the time and money it takes to have a comprehensive scientific investigation into which traditional treatments actually work and which don't. Some of the old ways were nonsense, and we have proven that. Some of the old ways were not nonsense like acupuncture and spinal manipulation like chiropractors do, and we have proven that too. This is why spinal manipulation is now part of international guidelines for managing lower back pain for example. But most just haven't been studied. So this brings us finally to the difference between scientifically unproven and proven unscientific. Do you understand that those are two different things? That's what we are here to explain to you and help you with. Give City Chiropractic a call on 04 385 6446 to make an appointment now.